Good afternoon, everyone. So an innovation would just remain a fancy idea until and unless it is executed and commercialized. So I'm here to present some of the innovations which we have done in the field of relaxed smile surgery, and I'm very thankful to Rohit Shetty sir and AIOC for giving me this huge opportunity. So we have been conducting a relaxed smile training program in our institute since almost 4 years now, and have trained over 60 international and national refractive surgeons. So the commonest issue which we have identified, which the beginners face in the learning phase of this procedure, is correct identification of the planes. Now, you have a refractive lenticule and you have a deeper plane underneath it and a superficial plane above it. So ideally, you should be dissecting the superficial plane first, followed by the deeper plane. In case you enter the deeper plane first and dissect it first, there is a risk that the whole lenticle can get...
You have a video here?
I have only videos.
But it's not playing, that's the thing.
There's an instrument, the self-guiding dissector.
No, but you want to play the... We thought that there's some problem with the mouse, so we thought you're not pressed it. Not yet,
yeah,
okay,
I'm
sorry.
No, it's not advancing, sorry. Yeah, so this is a self-guiding dissector which Dr. Sri Ganesh has designed. So this helps the beginners to identify the planes correctly. So the speciality of this instrument is that it has got two ends. The shape of both the ends has been modified in such a way that it identifies both the planes automatically. So at one end you have the convex side on top, and beneath you have the flat side. And on the other end you have the flat side on top, and the lower side is convex. So to identify the superficial plane, you need to use the side which has the flat surface on top. So you can see that very easily the surgeon is able to identify the superficial plane in this video, and the same instrument can then be used to dissect the superficial plane. To identify the deeper plane, you need to go to the other side and use the convex side up. So this automatically enters the deeper plane, and this is just like how a shoe hits the edge of a carpet and it automatically goes under the carpet and not above it. So this is how it goes automatically in the deeper plane. And you can dissect the lenticule very easily and extract the lenticule using the same instrument. So we have given this instrument to some of the beginners in smile surgery, and they have reported that it is easy to use and makes the surgery more convenient. So next video. Sorry, it's not working. Can you please play the second video? Okay, so the second innovation is a special corneal marker. So this marker is a bubble marker, again invented by Dr. Sri Ganesh. This gives 3 markings on the cornea at 3, 6 and 9 o'clock positions. The markings are long enough to be visualized within the cone after the docking. So you can see, you can mark the cornea at 0 and 180 degree, and this can be checked with the level of the bubble. So after the marking, you can dock the cornea and check if there is any cyclotorsion or not. If there is cyclotorsion, you can gently rotate the cone and align the marks with the horizontal reticule, horizontal axis on the right eyepiece of your reticule, and then fire the laser. If there is no cyclotorsion, then you can directly fire the laser. And this is how a refractive lenticule is being created. First is the deeper cut, the refractive cut, followed by a 360-degree side cut. And then you have the cap cut, which is about 1 millimeter wider than the optical zone. And finally, a small incision, which is 2 to 3 millimeters. So here I am showing another innovative technique of managing the lenticule, which we call as lenticuloschisis. So this is a no dissection technique of lenticule management in smile, wherein you use a micro forceps to catch the edge of the lenticule and then very gently peel it off the stromal bed, and hence without dissection you can actually remove the lenticule. Followed by this, you can wash the interface. Washing or no washing is a surgeon's own preference. So this particular technique may give better immediate post-op results with SMILE compared to the dissection technique. And, but we still need to do some comparison studies to actually check whether this has any significant advantages over the conventional technique or not. Thank you for your patient listening.